Welcome back. This is Dr. Becky. She is a dentist, another dentist that I work with, specifically my boss. So no stress cleaning her teeth, right?
I'm nice, I promise.
This is what I've been like waiting to tell you. So the first time I cleaned your teeth, of course I was nervous.
A huge piece of tartar.
You did?
No.
Oh my gosh. I was like nervous, but I was not as nervous as, because with the first time I cleaned your teeth, I already cleaned your mom's teeth once, which was a little nervous. Like I was like, oh gosh. But I cleaned one of your friend's teeth, maybe your best friend. And I remember thinking that was the most nervous I've ever been.
When you cleaned my friend's teeth?
Yeah. But I was just thinking in my mind, like, if you were cleaning my best friend's teeth, my best friend's gonna tell me everything. Like, I was just like, oh gosh, her friend's gonna tell her advice. I don't know. I was really nervous about that. And I'm sorry that you have this on your head because she wore a face shield right before this. That's the only thing I kept thinking. I'm gonna tell her how I was more nervous about her mom and her friend. I do feel nervous now, especially with the camera. So you have like nothing. I feel so bad that you just had a cleaning.
I feel like I'm good eye.
Something.
I'm gonna drink a Dr. Joe after this.
You are?
Are we gonna talk about dental things? Or are we gonna talk about life?
I think you'll talk about life. I always tell patients that you and Dr. Joe are like two peas in a pod.
One of our patients calls us Dr. Becky Joe.
Especially if someone's only met one of you. Now I have to start saying they're Dr. Becky Joe.
She thinks that we're the same people in a male and female form.
See?
I'm just not as good looking and as funny.
God. For a while.
Whitney will be like, oh, Dr. Joe's doing your exam today. You're gonna love him so much. And I'll be in the room right next door and I'll be the person doing the exam. And she's like, oh, Dr. Becky's doing your exam. You like her too.
Messed up a few times where I really thought they were seeing him.
Where I was like, okay, are you mad at me?
I really thought they were seeing him and then I saw like request Dr. Becky and I'm like, oh, never mind, you're seeing her.
Exactly. Oh, never mind, I messed up. You're actually seeing her. She's okay.
Oh,
now I have to do a cleaning with a different kind of scaler.
Oh. See, I'm so nervous. I just dropped a scaler. Oh, it's okay. We can use a curette. Do you use curette?
Yeah, I didn't on you, but yeah, I do.
Yeah, I'm not a big curette girl. I feel like I can't get in the inner proximals as well. Are you okay here? I'm not hurting you? Okay. I always do the upper anteriors last. I feel like it's such a fun finish, or upper.
I think the upper anteriors feel the coolest as a patient.
Really? A lot of people, I feel like, are very sensitive on the upper anteriors if they have sinus issues and stuff, especially with parocharting. Life is a wild thing though, isn't it?
Your life is.
No, Dr. So this is.
That's because I have 4 kids.
You do. That's what I'm saying. You do, and you handle it very well. And I'm working on that. That's like my hardest thing.
I have you hold.
Yeah, have you hold? Do
it. Paparazzi at your wedding. Are you us, man, Zach? You're lucky you made it in the wedding party.
Yeah, really. Now when he ever comes over to my house, he parks like a quarter mile down the street.
I can't use any of this. Is anything that we've talked about okay to use? You know what I do now? I double check with the Explorer before polish. Is that weird? Just makes me feel good. Once I did it and a patient said something like, I love how you do that. It makes me feel like you're so, I don't know, something good. And so ever since then, I've really been doing it because I was like, someone told me they liked it. Just like interproximal and make sure. And then sometimes like right there's a little piece of plaque. And then I was like, what? It's probably because I used the curette in this section. Love that thing you told me about doing the whole.
You told me.
I don't
think you did.
I don't think.
Difficult patient. Like, what if I was?
What do you think about when you're cleaning someone? Do you think about them and what you want to talk to with them, or?
I usually give a lot of monologues. Like, patients can't talk back a lot with the stuff that I'm doing. I mean, they can a little bit, but you do I just tell stories.
I feel bittersweet because I'm talking about all these things that I like so much. I like Debbie watering the plants when she stands on the thing. Funny.
That's what she's gonna miss? Really?
That'd be so funny. She's always on counters and stuff, and she's wonderful.
That's definitely one of the best parts of working here.
They probably don't even feel that different because they were so clean.
They feel phenomenal.
Oh,
so
that's a good thumbnail. Yes.